Our next guest says he has a plan to completely replace the president's bill. Joining us now, physician and Congressman, Republican Tom Price. Congressman, thank you for joining us today.
Hey, Shannon, thanks so much. Good to be with you.
I want to start, before we get to your effort, asking you about the delay of the employer mandate for the health care law that was set to kick in. I know there are calls as well and votes as well about whether the individual mandate as well should be delayed. Do you think that's going to get any traction?
Well, the administration itself actually delayed the employer mandate. Remember that the employer mandate and the individual mandate is the requirement of the law that every single employer provide health coverage for their employees if they have more than 50 employees. And every single individual in the country has to purchase health coverage that the government forces them to buy. So that's what we believe is not one of the not appropriate things about this law. So this past week, the House of Representatives said that the administration, the president had it right. We ought to delay the employer mandate, but we also ought to delay the individual mandate. Businesses ought not have something that individuals don't. So we ought to make it fair. Individuals ought to have the same kind of delay. Now, once that happens, once we're hopefully able to get that delay, then we need to move forward with real, positive, patient-centered reform where patients and families and doctors are making medical decisions, not Washington, D.C.
All right, and to that point, I want to play a little bit of what the president had to say about others out there who may have ideas about the health care law, about how to address the issues that across the partisan spectrum, folks agree that we do have things that need to be changed. Here's a little bit of what the president had to say.
If the folks who have been trying to make political hay out of this thing, if they had some better ideas, I've already told them I'm happy to hear them.
All right, so it sounds like what you're offering up now, Congressman, is what you view as your better idea. Tell us about it. Do you think the president will listen?
Well, you talk about political ideas. The president announced his employer mandate delay until after the 2014 election, but set that aside. Look, this is exactly what the president said. That is, he wants to hear from everybody during the whole debate during 2009 and 2010. At that time, we had a positive piece of legislation, an alternative. We asked the president every single week. I was chairman of the Republican Study Committee at that time. Asked him every single week just to sit down with us, hear our ideas, because we believe, again, that you can fix these challenges without putting Washington in charge. The president never ever met with us. I'm not holding out a whole lot of hope that he'll do it this time. But hopefully, if and when he does, or somebody in his administration, they'll recognize that you can get folks covered, you can solve the insurance challenges, and you can save hundreds of billions of dollars in this healthcare system, all without putting Washington or insurance companies in charge of those decisions that ought to be between patients and families and doctors.
All right, so how do you go about doing that? Because we've spent thousands of pages apparently not solving those problems. What's your plan?
That's right. The plan that we have, H.R. 2300, is a comprehensive piece of legislation. It makes it so that every single American has the financial feasibility to purchase the coverage that they want, either through tax deductions or credits or advanceable credits or refundable advanceable credits, so that everybody can purchase the coverage that they want for themselves and for their family, not that the government forces them to buy. Second, you have to solve the insurance challenges, and there are real big ones out there. The two biggest are either portability or pre-existing. You ought not lose your insurance if you change your job or you lose your job. You ought to be able to take it with you. That's an easy one. Just make it so that everybody owns their own coverage, just like a 401k plan. If they change their job or they lose their job, they take it with them. And then the pre-existing illness challenge is huge for those folks in the individual and small group market. We ought to allow all of those folks to pool together so that you get the purchasing power of millions, so that one individual's adverse health status doesn't change the cost for anybody else, including that one person. Those are solutions, again, that put patients and families and doctors in charge, not Washington, D.C. You don't have to have Washington running the show to be able to have a health care system that works for patients.
All right, we're out of time, but I want to quickly ask you a question. Will you have any Democrats you think sign on to this effort?
Well, I sure hope so, and we've been trying to educate folks and assure them that this is a solution that works for those patients and families and doctors. I call out to all my Democrat colleagues and Republican colleagues to get on board. There are positive solutions to these challenges that we face.
All right, Congressman and physician Tom Price, great to see you.
Thanks so much.